So I'm going to talk to you about my philosophy on scarring and how best to manage them in the post-operative period. We all want to have a great scarring outcome, and I want that for all my patients. And this is a simple set of steps you can follow to give yourself the best chance of having a great scarring outcome. I think the thing to remember is that probably 90 to 95% of people will get to a great scarring outcome doing very little with their scars. But if you really want to be trying to do everything, then these are the steps you can follow. So number 1 and 2 go hand in hand. And number 1 is massage your scars. Number 2 is moisturize your scars. So if you're going to be massaging and moisturizing your scars, the evidence comes from the burns data, particularly of problematic scars and burns, that these really help, okay? They help with collagen realignment and conversion of collagen from one type to another, which is what's happening in your skin when your scars are maturing. So with massage, you want to be doing it 2 to 3 times a day minimum. You want to be doing it for 1 to 2 minutes at a time, and that massage should be firm and circular. Obviously, that will get more comfortable as your scars mature. Delivering moisture to the scar, which is number 2, is done really with any cream, any aqueous cream. So it's better to use a hypoallergenic cream because you're going to be using a lot of it. And there are a lot of really well-marketed creams out there. None of them really make much difference. The active ingredient doesn't matter so much. There's been no proof that one active ingredient works any better than any other, but an aqueous cream is a good start. So something like Cetaphil, in the UK it would be E45. Those are really good creams. You massage them in for 1 to 2 minutes at a time, and then you want to keep moisture next to the scar for longer, and that's where a scar layer comes in. So all of these ointments you see, they all kind of achieve the same thing, which is keeping moisture next to the scar longer than cream alone. And in this instance, I would suggest using a silicone ointment because I think that's inert. People don't tend to react to it. You can use sheets or ointment, and after you've done your moisturizing, you can put a layer of that on top of the scar. And really, you should have silicone next to the scar 24/7. So you can take it off or rub it off in between your massage sessions and then reapply it. The third one is sun protection. So we should really be putting high SPF cream on our skin most of the time when we're out in the sun, because that's going to protect against sun damage. It's going to protect against photo aging. And also we know that scars hyperpigment, so they pick up pigment more than the surrounding skin, and you don't want that to happen. So slap on a bit of 50 plus on the scar in the morning as your first massage of the day, and then you can apply normal creams for your subsequent massages, unless you're going in and out of water, in which case you want to be putting more sun cream on. And the final one, and the most important of all, is time. Scars take 12 to 18 months to fully mature, and that varies from person to person and from scar to scar. But really you want to wait at least 12 months before you judge the final effect of your scar, because it will keep improving in the vast majority of cases. But of course, if you think the scarring is becoming problematic sooner than that, then you should go and see your physician and get their opinion and double check. So for all my patients, that I would advise that they follow these instructions for as long as they feel is necessary until they've got a good scarring outcome. And the door is always open in my practice to come and see me about problematic scars and discuss options that might be available. But essentially with these few simple steps, you should be able to get yourself a great scarring outcome 99% of the time.